Thank you, Hindi team. Thank you, everyone. Thank you, Sani sir. Now we are moving to English session. Today is our 1955th day of continuous webinar. There is no break, no leave for our webinars. We are continuously conducting this webinar in three languages. Thank you all the participants, faculties for your support and presence here. Let's start the meeting with a silent prayer. Good evening once again. Today is our 1955th day. Today's our guest is Dr. T.N. SREEDHARA KURUP. I think there is no need of any introduction about SREEDHARA KURUP sir. Sir is always traveling with IFPH and motivating us. He is always a leader in our team. And he is MD in Homeopathy, M.Sc in Psychology, M.Sc in Yoga, former Assistant Director of CCRH, Kottayam, more than 48 years of experience. Today he is talking about the management of mental diseases with homeopathy. Sir, you are welcome. Please unmute yourself. Sir. SREEDHARA KURUP sir. Oh, I made you as a co-host before. Okay. Okay, sir. Now you are co-host.
No, it is audible.
Yes, sir. Audible.
Most welcome to all, especially the organizers of the IFPH and the coordinators and the moderators and all other its executive members. From beginning itself, I started taking the seminars. So I thank you one and all for giving me all the chances. Today, my subject is mental disease and its homeopathic management. So I start with praying to the Almighty and our Master, Dr. Christian Patrick Samuel. So first that I start with a word regarding the current warning. He is telling, don't decide that you will love yourself unconditionally tomorrow. Do it right now, this minute itself. So I can share my slides I'd like to share. Not getting.
Yeah, it's visible, sir, but small.
Yes, that is. I cannot see, that is the problem.
Document from, I think, mental disorders, it's a small slide, not from your Gmail.
Yes. Wait, let me.
Okay.
Now it is.
Yeah,
Okay.
you click this. But it is not.
It's very small, I think so. How I can make it into bigger one?
Sir, first you have to, yeah, started, sir. Started.
Okay, wait a minute.
Yeah. Mental disorder and anxiety.
Okay. So, there's really recently one lady doctor, I think that Surabhi, Dr. Surabhi took the anxiety and fear. So I am not going to very detailed. And not only that, I took the class about 1 or 2 years back regarding anxiety, each and every one fear. So I am going only for that mentioning, not so deep. I am not going, because recently 2-3 days back, one madam.
Sir, that is not a problem. Well, while you are hearing again and again, that will help us. No need to cut short. You
Yes, anxiety, pathophysiology of anxiety. You can see, or it is very small. How I can make it in the big screen?
Yeah, now we can see, but I don't know where. I think that plus signs, no need, sir. I think it is.
You can read. Then it is all
Yeah, yeah,
right. Okay.
yeah. We can read. Otherwise, it will again.
It will go here and there. Pathophysiology of anxiety. One, neurotransmitters, imbalance of neurotransmitters like serotonin, dopamine, and GABA, which regulates mood and emotional response. That is the first one. Second, hypothalamic pituitary and adrenaline axis overactivation of the HP axis, leading to increased cortisol levels, which can contribute to anxiety. 3. Amygdala hyperactivity in the amygdala responsible for processing emotions, leading to exaggerated fear responses. 4. Professional or prefrontal cortex dysfunction in the prefrontal cortex responsible for regulating emotions and decisions making. These are the pathophysiology of anxiety. Five. This is visible in Hello.
Yes, sir. Is visible.
Yes. By stress response, chronic activation of the body stress response leading to the physical symptoms like rapid heartbeat, sweating, and tremors. Genetic predisposition can play a role into the development of anxiety disorders. Brain region, abnormalities in brain region like the hippocampus, cortex, and insula can contribute to anxiety. There are several types of anxiety disorders. Generalized anxiety disorder, that is GAD, excess and persistent worry about the everyday things. Panic disorder, panic attack, often physical symptoms, and shortness of breath. Social anxiety disorder, fear of social situations, fear of judgment, or fear of embarrassment. Specific phobias, irrational fear of specific objects, situations, or activity. Several types of anxiety disorders. Obsessive disorder, that is OCD, thoughts, obsessions, and repetitive behaviors, compulsion. Stress disorder, PTSD, anxiety, and flashbacks following a traumatic event. 7. Separation anxiety disorders, fear of separation from a person or place. Selective mutism, failure to speak in certain situation due to fear or anxiety. Today also I got one case. This selective mutism, that failure to speak in front of. There is one 45-year man from Trivandrum called, and then he we got appointment, and he is having to go to banks and to speak others. He is, whenever he may go to outside, he must have to drink, not continuously. When he may go to one, before going, he will take 1 or 2 pecks. Otherwise, he will get trembling and he cannot appear in front of that. That is the case. I started studying, and then I may, within 2 months, I may go to Kerala. He will definitely will come and meet me. Then anxiety due to medical condition, anxiety caused by medical condition or medication. Then substance-induced anxiety disorder, anxiety caused by a substance use for withdrawal. Yes, it is can even excessive use of any stimulants, that means drugs, that also can be cause, or the withdrawal symptom also can cause anxiety disorder. Mixed anxiety and depressive disorder, combination of anxiety and depressive symptoms. Usually these mental diseases, sometimes it will be, we can understand there are different types of the disease will unite together, and we cannot diagnose. It is sometimes difficulty. What type of, whether it is depression, whether it is anxiety, whether it is fear, or sometimes like that of it is difficult to diagnose. But for us, it is our advantage is that any type of the condition may come. We are depending upon mainly symptoms and the drug selection according to the individuality. So we have no any problem. Whether it is anxiety, whether it is depression, whether it is stress, whether it is mood depression, mood differences, anything that we can treat according to symptomatology, we have no difficulty. Fear is a fundamental, next one. Fear is the medicine I shall talk later altogether. Fear is a fundamental human emotion characterized by the perceived threat or danger, triggering a physical and psychological response. It is a natural survival mechanism, but excessive or irrational fear can lead to anxiety disorder. Yeah, of course, all these emotions in human being, it is natural, but when it is more, then only we must have to worry. All the emotions we will get if, as a human being, we will have all this type of the emotions, that when it is more, then only we must have to take treatment. Up to a certain extent, there is no need of treatment. Pathophysiology of the, it's not, oh yes. Pathophysiology of fear. Amygdala activation. The amygdala, a small almond-shaped structure, processes emotional information and dictates threats, triggers fear response. Whether it is possible to read, moderator.
Yes, sir. Yes.
Yes. Second, neurotransmitters. Release of neurotransmitters like glutamate, GABA, and dopamine, which regulates fear processing. 3. Hypothalamic pituitary adrenaline, SPA axis, activation of the SPA axis, leading to increased cortisol and adrenaline release, preparing to the body for fight or flight. For fear, circuitry activation of brain region like the hippocampus, anterior cingulate and cortex and insula, informing the fear circuit.
Sir, I think you can see the page number and one minus and plus signs are there, right?
Okay.
If you are pressing in the plus sign means it will enlarge. I think so. Can you try?
I have one difficulty. I have it is difficulty when it will disappear or still again it will go.
Yeah.
Once
Okay, no
inside, then
problem. We can read. Just I said, okay, you can read.
okay. Press sign.
No need, sir. If
Okay. Fear. Pathophysiology of fear continues. Conditioning and learning. Fear can be learned through classical conditioning, associating stimuli with danger or social learning, observing other fearful responses. Genetic predisposition. Genetic factors can influence fear processing and increase susceptibility to anxiety disorder. Because there are so many, I saw so many families because I was worked in a mental hospital for so many years. I am giving more importance last 25 years for these mental diseases. So with handling, I find out there are some families, there are some hereditary. This is regarding anxiety, fear, and depression, and all these things have some hereditary trends also. Brain regions, abnormalities in brain region like the prefrontal cortex, which regulates fear exhilaration, can contribute to excessive fear. Stress and trauma. Traumatic experiences or chronic stress can alter fear processing, leading to anxiety disorder. Yes, sometimes some physical or mental traumas also can cause that the fear. Sometimes calamities, some other type of this. Next one, stress. Whether speed is more or not. Hello, madam.
sir, it's okay. Okay, you can continue with the same.
Stress or tension is a state of mental or emotional strain caused by adverse circumstances, leading to complex physiological responses. Stress is one of the most important factors nowadays because earlier there is a combined family. Now it is separate family. Each families are separated and they are living, and both parents, that mother and father is going and children are alone. That is so for the parents also it is stress, for the children also it is stress is more. So there are so many stress related diseases are coming. Pathophysiology of stress. Hypothalamic pituitary and HAPA axis activation stress triggers, and SPA axis releasing cortisol, adrenaline, and other hormones. Sympathetic neuron system activation, the SNS responsible for fight or flight is activated, increasing heart rate, blood pressure, and energy levels. Neurotransmitter imbalance. Stress affects neurotransmitters like serotonin, dopamine, and GABA, including mood and emotional regulations. Inflammation. Chronic stress leads to increased inflammation affecting various body systems. Food brain influencing mood, cognitive function, and overall well-being. Pathophysiology of the muscle tension. Physical tension leads to the muscle strain, pain, and fatigue. cardiovascular response. Stress increases heart rate, blood pressure, and cardiovascular risk. Immune system suppression. Chronic stress weakens the immune system, making us more vulnerable to infection. Hormonal imbalance. Stress affects hormonal imbalance, including thyroid, insulin, and growth hormones. Brain region activation. Stress activates brain region like the amygdala, hippocampus, and prefrontal cortex, influencing emotional processing and regulations. Depression. These are the mental diseases are divided into two, mainly into two. One is mild and another is very severe. These are the mild. This we can described as or pressure or a long period of time. Depression is different from regular mood changes and feelings about everyday life. Depression can happen to anyone. People who have lived through abuse, severe loss, or other stressful events are more likely to develop depression. Women are more likely to have depression than men. See, most of the people have that depression in a short period or long period. But without depression or all these type of changes in the mind is very common. That even stress, even anger, so many type of the emotions we can see each and every person, but it will be little more or little less. Depression, pathology of depression, pathophysiology of depression, neurotransmitter imbalance, decreased levels of serotonin. Yes, these are serotonin, dopamine, and hyponephron, which regulates mood and emotion. These are the three. These neurotransmitters are the main reason for all this type of the emotional disturbance. Hypothalamic pituitary adrenaline axis dysregulation, hyperactivation of the SPA axis, leading to increased cortisol level, contributing to depression. Neuroinflammation, increased inflammation in the brain, affecting neutral function and mood regulation. Neuroplasticity changes, reduces neurotropic factors, leading to decreased neutral connectivity and synaptic plasticity. Hippocampal atrophy, reduced hippocampal volume, active memory, and mood. Pathophysiology of depression. Amygdala hyperactivity, overactive amygdala leading to exaggerated emotional responses. Prefrontal cortex hyperactivity reduces activity in the prefrontal cortex, impairing decision making. Alter biome influencing mood and cognitive function. Hormonal imbalance, changes in thyroid, insulin, and growth hormones levels contributing or depression. Genetic predisposition. Genetic factors can increase susceptibility to depression. These are I am giving more importance. These are in the book, and even so many people, even I myself took several times the depression, anxiety, fear, etc. Now, the most important the thing is that our homeopathic medicines, Here are some common homeopathic medicine I shall explain because I couldn't go very detailed for to the that causes and signs and symptoms and etc. Because several times myself took several classes regarding depression. Even 4 5 years back, first I took the depression, then the anxiety, fear, and etc. I took very detailed. So I give in a only a revision like that of main points only I discussed here. There are some common homeopathic medicine used to address anxiety, fear, stress, and depression. The first medicine is, there are very few. There are so many medicines in our America. N number of medicines are there for, especially in the mental condition. We can treat better than that of any other system, including that the modern medicine we can treat and cure completely. They cannot give. Whenever they may remove the medicine, it can come again. But our medicine can cure completely with this. I am sure with so many cases, I am successful. Aconitum for sudden intense anxiety. Acnate is having anxiety mainly for anxiety and fear for death. That you know that acnate is having that anxiety in acute conditions. It is one of the first and best medicine. Argent nitricum. Argent nitricum for anxiety with restlessness. Argent nitricum is having whenever the fear and anxiety. I know one case that I treated myself. One of my neighbor was having this problem, that anxiety, neurosis with restlessness. Whenever somebody is in the hospital or suffering some disease, he must have to go often for the toilet. This is or urination. This is one of the special symptom of the argentum nitricum, which I understood that I experienced myself with several times with that so many patients. So argonitricum is one of the another best remedy. Gerstemium for anxiety and fatigue. That that gerstemium. I treated a case of uh, anxiety and fear in the time of the our that COVID time. There was one person who was admitted in a 5-star hospital and give injections and everything, but he was having fear and anxiety. He feels that he may die. His blood pressure increased, blood sugar increased, and so many other that the cholesterol level increased. So many other factors that which is increased, parameters increased, but only few doses of gercemium it cured completely. There are several type of the anxiety neurosis is cured with the gercemium. Then another medicine is kava kava for anxiety with muscle tension. There is a stiffness in the muscles that we can feel in the kava kava, which is also one of the best remedy. Then passiflora for anxiety with insomnia. Most of the time, the anxiety there is sleeplessness. In sleeplessness condition, you give passiflora. Another medicine is Navaina Sadhiva. Navaina Sadhiva will also give very good result in that this thing and that the anxiety and sleeplessness. Navaina Sadhiva is also another medicine also. I can say yes, aconite, it is acute anxiety with agonizing terror and fear of death. Frequent palpitation, the patient is impossible and restless. Anacardium, anxiety, man is on eating, that he will get relief by eating. Argent and nitricum, I already explained. anxiety with diarrhea, humid, irritable, nervous, and lack in self-confidence. Arsenic karma. Intense anxiety with great restlessness. Fears something terrible will happen. He is burst during the night and after midnight. Very chilly, except and pot painting. He is meticulously tidy. And this arsenic and aconite, we must have to introduce. It is for a example. The differentiation individualize the patient anxiety and fear this aconite is having. They feel that they may die very soon. They will see that they will get immediate death, so they must have to rush to the doctor. And both are having thirst, but aconite is having a thirst for larger quantities of water. Arsenic is having a small quantities of water. Aconite is a hot remedy, and he is very restless. He cannot sit one place. He will go here and there, and he is restless. He is so strength is so high. Energy is so high, but arsenic is so tired, no strength. He thinks that he will not take medicine. Even taking the medicine is no use. So he will sit without, he is not ready to consult a doctor. He thinks that no medicine cannot help. These are some of these things. And aconite is a hot medicine, arsenic is a chilly patient. So these are like that we must have to demonstrate the thirst, fear, and so many other things are we can compare and find out. Next medicine is borax. Anxiety leading to nausea with fear, especially downward motion, which is aggravation time is till 11 in the up to midnight. He will have more problems and he will sit in the bed and he cannot. Recently, I heard a case of one man cannot. He is now 75 to 90%. He is having childhood. He was having that ADHD. Now he is grown up 45. He is treated with allopathy, even Ayurvedam and psychotherapy, so many other treatment, but he couldn't. Now he cannot, he can climb or come back to he was not able to come down. Fear for coming down in the steps. The borax 0/3 few doses drastically improved. Now we can climb or come down to the steps. This is one of the best medicine for to the analgesic to with nausea and fear of downward motion. It is one of the best medicine. Bryonia alba. Anxious about business, even though seriously ill. He is always to think about he will fail with the business anytime because he is always worried about his business and his earnings. The patient thinks that he has done something wrong. He feels uneasy and anxious with the palpitation, fear loss, reason, respect of life, fears insanity, makes others bored by repeatedly described ailments. He will always complain, I am having that or I am having this. They are very lazy also. He feels, yes, I am done something mistakes. Always he thinks that. Especially Kakaria is having such type of the anxiety and fear. That fatty fear and fire that we know, we learned that. Carvovage, anxiety is burst that lying in the bed with eyes closed. Caustic. Anxiety waits in the evening due to the apprehension. As Jim already mentioned, anxiety due to fright, fear, emotion, exciting news, or forthcoming examination, interview. That especially for the school-going students, before going to, and also in the stage fear also, gelsemium is one of the best medicine. Ignatia, anxiety due to the any type of the grief. Grief is the worries and grief is the main theme of the ignatia. Due to that, anxiety is there. Again, it may happen, they will feel. Lachesis, nocturnal attacks of anxiety, cramps in legs from fear. It is especially in the night, they are having cramps in the glycopodium. Anxiety with lack of confidence, the patient is unable to sleep due to the happening during the day. Anxiety about the forthcoming. They may do something and they will think about that and that. Manganam anxiety. Anxiety bursts by lying still. Sad music lessens the anxiety. But there are some other medicines like tarantula and etc. It will increase. Also, some of the medicines, it will increase also. More anxious about everything, even as anxious dreams. They will see the horrible dreams, especially regarding the, I treated recently a case of dreams of robbers and one depressive case with anxiousness, that with Natromore, completely it is cured. Phosphorus. Very restless patients who are sensitive, they need security and constant reassurance, anxious restlessness, nervous due to the fear of darkness, thunder, alone or dying. Even stramonium is also one of the medicine for the dark, fear and anxiety of darkness. Parsatilla. Anxiety after bad news or an emotional upset, the patient is weepy, touchy, and needs to always they will change. Sometimes they will cry, sometimes they will laugh also. Even they are crying, you may say some jokes, they will immediately laugh. Sepia, anxious towards evening, dread to be alone, indifferent those doubt best. That you know, indifference is one of the most important character of the sepia. Sulfur, anxiety is very sweat in the morning while sweating and fainting spells. This is an intercurrent remedy when indicated medicine is not acting. So these are the ones, some of the, because why I took so much time for to the medicines part, because rest that you all are taking hours together, we can go.
Excuse me, sir. Up to passiflora we can see.
Yes, the rest is not mentioned in the slide.
Okay.
That I prepared separately from different books.
Okay, no problem.
That is not there. Next is fear. Only 4-5 medicines only, not included into the screen. Rest that it is from my side. Okay. Here also fear is acnate is there. Sudden events and etc. Especially for the death and arsenic also I explained already. Fear for being alone. They want always company. Borax I already explained. Stramonium also I explained, fear of darkness or night. Valeriana, fear with restlessness is another medicine. Here there are so many medicines. Aconitum I am already explained, so I am not. Fear of crowds and streets. They don't like to go to the front of. I recently treated a case, a man, tribal. He will not go to the crowds. We will go if there is a meeting. He will tell, I don't come up to the place. But before that, about half a kilometer away, he will leave the customer and he will leave. It is completely cured with acronite. Fear in aeroplane, flying above. Some people are having fear and there is distress during in the aeroplane. Such people also, acronite is one of the best medicine. Anacardic, fear of examination and fear of persecuted. If they may see the police people, they will run away. If very near to the police station, if somebody may neighboring house, it may come. Recently, I cured a case of when he may see the police, he will fear and he will run away. He will hide. Then Anakadi cured him very ardent and critical. Operation before an event, fearful nervousness, melancholic, lack of self-confidence, impulsive, wants to do things in a hurry, great desire for sweet things, diarrhea from fear, fear crowds as in temple or in church, in cinema or wherever there is a people are more, or some bad news also may get, they are very anxious and they will often go to the toilet. That is one of the most important remedy that and its indication. Arsenic or fear of death that I already explained. Belladonna, fear for dogs and animals for fantastic illusion wants to escape. Even tuberculum is also having fear for animals, especially dogs. Borax, fear of downward motion that I am already explained. Karkarika, that also explained. Postical, child is afraid to go to bed alone. Always they want somebody to accompany them. They will wait for to the mother or father or sister. They will wait for to them. Otherwise, they cannot go to the uh, bedroom. They will fear. Even they may go to the bathroom. They will tell somebody must have to accompany them. They'll see me. Even thunderstorm, they are having a fear regarding thunderstorm and fear regarding the miscarriage. And they are always thinking about bad side, especially for the examination. They may fear for failing or falling, and always the child will grab the nurse or the mother or father when they are carrying. They have a fear for fall. Iosiamas, fear of being pursued, fear of people around how stand against him, fear or account of suspicion or the fear of being poisoned. Yes, this is one of the most important, especially Iosiamas is one of the best remedy for nymphomania along with the fear of people and they feel that they are suspicious. They feel that somebody is put poison in their food, so they will always suspicious. So many cases I was able to cure with the Iosianas. Karika, full of fear, imagination, is being left alone. Lycopody, it is a wonderful remedy for anticipatory fear, examination students, fear of being alone, fear of men and even his own shadow. Yes, one case I got once that one fellow was in the going in his he's a homeopathic doctor himself. He was coming from he must have to cross that one paddy field. There one canal was there. He saw in the light of the moon, he saw his own shadow. He was got fear and he was out of sense. So lycopodium, few doses completely cured him. Man is in the fear of becoming insane. Madonna, fear that he will go insane, fear of darkness, and someone is being here, fear that she cannot recover from her illness. This Madonna is an intercurrent remedy. Whenever that they will feel, I am going to be mental patient, I will not get rid of any disease. And that type of the fear you can, as a intercurrent, you can, if there is no relief, you can give Madonna. Monosmonic, fear of upward verse. Yes. That downward, it is borax, upward. Here are going to the higher places, monosmonic. In so many cases, I was able to identify with this symptom. Opium, fear causes diarrhea, disease that originate from pride. Phosphorus, fear when left alone, fear of illness, fears that something will go wrong, fear imaginary things, fear of darkness, very sensitive. Then picric acid, anxiety and fear of failure in examination. We think that only Judge or ardent nitricum are the medicine, but picricum acid also having that the same examination peer. Parsatla, peers being alone, the dark and ghost, words in evening, like sympathy, and easily timid and irresolute. Sanicula, of downward version. That other medicine is borax, sepia. Trud be alone, fear of evening and darkness. Spigeria, fear of nice, fork and all pointed. Even that especially knives and or some needle-like things also, even spigeria, one of the best remedy for that. Sternament, fear, painting and weakness when going downwards, but can go up well. Sternament, going downwards. That there are how many medicines are there? Picricacidum. So many other medicines also there that I mentioned, that borax one, sternament also going downwards there. And argent and nitricum, fear of trains and closed rooms, claustrophobia. Even Simisimuga is also having the same type of the phobia. Veratramad passes urine or stool, wind or account of sudden fear of thunder, of clouds or lightning. Even during rainy time, lightning, veratramad is one of the best remedy. Then stress medicines. Ashwagandha, it is one of the best medicine for the stress for and fatigueness. This is a rare medicine. I got it from a journal. Some journal I got these things, so I don't know whether it is available or not. But it is mentioned in that article. Stress with exhaustion, insomnia. That is a very good medicine for stress with mental fatigue. Even Avena Sadeva Mother Tincture also very good for the stress and mental fatigueness. Then rhodiola for stress with mental performance. It is for stress with emotional exhaustion. Stress. Stress, many consultations with homeopaths are stress related. Stress is caused by higher levels of cortisol. The body means stress hormones. The human body is able to deal with stress for a short period of time before some symptoms appear. These should be treated with indicated remedy. High levels of stress can cause insomnia, migraine, and fibromyalgia, immune system deficiency, hypertension, heart attack, stroke, depression, chronic fatigue syndrome, and irritability. Along with the treatment prescribed below, the stress can be reduced by the following medicine. There are some exercises. Add more fun to your life. Do things you enjoy what you do. Pursue a hobby. Gardening is a soothing exercise. One vacation. Get enough sleep and rest. Your body should rechange the discharge tension. Laugh often. Laughter is a great tension breaker and it enhances the immune system. Rent a funny movie. Read a funny book or TV show that makes you to laugh and keep it on. And for stress emergencies, which a comedy movie. Regular exercise is a great way to relieve tension, increase energy, and improve the mood. Find an activities you like and do it often. Going for a walk, clear the mind. Love more than to use this to love people instead of the other way around. Helping others through voluntary work take attention away from anxiety. Eliminate self-pity. You may get sympathy for a while, but soon you will get avoid. Develop meaningful relationship. It is important to have good friends in whom you can confide and find support. It is important to be true friend, talk so much friends. When only believable people only you make friendship, otherwise some people will take advantage about your all secret. They will suppress you and make problems. Alter behaviors and attitude. When ideas or views are not serving you, well, change them. Learn to respond to situation, not react, compromise. Learn relaxation technique like meditation, yoga to experience inner peace. That means relaxation. There are so many types of relaxation from head to foot. Slowly relax, relax, relax. And there is a quick relaxation technique. You sit like this and relax. You sit, remove your this first button of your neck, and then you sit easy and relax. Expose your feelings, do not suppress your emotions. It can create stress, pain, and illness. Nicotine, alcohol, caffeine, sugar, and refined carbohydrates should all be eliminated from consumption. These substances rob the body of stress, fighting vitamin B and C, potassium, zinc, and magnesium. Ashwagandha, I am already mentioned. Then ginseng is another. These two remedies are very important. 10 drops a dose thrice daily reduce stress by helping adrenal gland to function properly. Adrenal glands are the main glands responsible for dealing with stress. The mixture also give, but I don't give the mixture. Some books it is written, the mixture is very good and it will give very good result, but I don't give. I will give a single remedy, but I may alternate. I take 15 drops 3 times a day. Very good result to reduce stress and depression. It increases blood flow to stress tissues and is tranquilizer. It can be used when no definite symptoms can be found. Select an indicated remedy. This is for only immediate relief, not complete cure you don't get. But immediate relief, you must have to analyze the case and find out a constitutional remedy. Kava kava. This is a very good remedy. 10 drops a dose thrice daily brings about sleep. When the cause is stress, the anxiety is any side effect, it should not be used by pregnant and nursing women. And patients suffering from Parkinson's disease also, you must not use this kava kava. Lavender oil. Lavender reduces anxiety, tension, and stress. Put a few drops of lavender oil on a handkerchief for smelling and few drops of it on the pillow before going to bed. Oxymum sanctum. That is also mother ginger. 10 drops in half glass of water. It is an anti-stress remedy. In Hindu temples, its leaf will be diluted with water or milk and given to the devotees as a prasadam. Giddiness by walking, better by wrapping the head. These are the main symptoms. Numerous studies shows that psychological stress can lead to illness and even death. The pressure of daily life, relationship, money, raising children, etc., cause stress, and prolonged stress contribute to many physical and psychological illness. No. Okay.
Finish, sir?
Yes, one more.
Okay.
Depression medicines only. Only 3-4 minutes it will take. No harm.
We have 4 minutes more. No
Okay. Orometallicum for depression, that one of the first medicine. What it is feel, it is useless. So I must have to, they may suicide. To such type of the depression, deep depression, you must have to give few doses of orometallicum, it will prevent. Then Ignatia amareta. Ignatia for depression with emotional sensitivity. Natromur also one of the medicine for depression. Patsatilla for depression with mood saving sepia. This is also another one of the medicine with emotional distress. There are so many other medicines that it will take another 5 to 10 minutes. So there is no time. So I am stopping here. There are so many. We can cure this depression, anxiety, fear, and mood disorder. That means stress. You can cure with the homeopathic medicine very effectively, very, very effective. Here, you can challenge the allopathics, especially the so-called psychologists and psychiatrists. We can do better result than them. I am experienced with that. With my experience, I am telling you try, and you will get more result. Thank you, one and each one, for to hearing and peaceful listening. Thank you very much from my heart, especially the people who are. How many people are there here? I can't see.
Thank you so much, sir. Thank you. Even though he's a good practitioner, good homeopathic practitioner, his passion for treating mental diseases is exceptional. Thank you so much for that. I think he's again and again studying mental conditions and its medicine. And sharing his knowledge to us. I have one question, sir.
Yes, most welcome.
You are treating you are curing the such conditions, right?
Yes, yes.
So will they get the attack again in some stressful conditions, or will they cure completely?
First, that there are so many other allied subjects also. Psychotherapy, that the counseling, and there are counseling itself. TA counseling is there. NLP is neuro-linguistic program is there. So many types of methods along with the homeopathic medicine will give easy result and complete cure. And sometimes what happens, after some time the patient will discontinue. It will require complete cure, it will require sometimes 6 months to 1 year. Sometimes the patient will think that like that of swiping pills, after taking the medicine you will get immediate. It is not possible. It will take so many measures. A depressive patient must be, such patients must be changed to the place. That itself will, sometimes the circumstances make the people create. Suppose a diverse person or a widow or male or female, if they may continue as it is, they will be depressed and stressed, and they may have anxiety and etc. But the circumstances must be changed, and they must be remarried again. They will get a good spouse. That itself will give a good relief. Not only the medicine, that I may say, Marunnu, mantra, tantra. Marunnu means medicine. Mantra means counseling. Tantra means that the psycho
Psychotherapy, sir.
Psychological treatment. These all together will cure. Treatment means not only the medicine, so many other factors also involved. Then only it is possible to cure. Same when there is a drunkard in house and beating the wife every day, and the same circumstances, the lady may remember.
We have time limit. We already crossed our time limit, but Ram Parvesh sir, I have something to ask you. Sir,
Yeah.
we finished our time. Even the
Let him ask a small,
please.
1 minute.
Yeah. No, not even 1 minute.
Thank you, Anjali, and congratulations, Dr. Ian Kurup sir. Happy New Year.
Yes.
Very good. Describe the emotional medicine. Many kinds of lot of medicine, fear, stress, and depression. Very good describe. So very, very thanks, sir. Good, sir. Thank you.
Thank
you, Ram Parvesh sir. Thank you, SREEDHARA KURUP sir, for again and again giving us more knowledge about the mental diseases. Thank you so much. Love you all. See you the same time tomorrow. Now I am inviting Dr. P. Shaila for moderating Malayalam session. You are welcome, Dr. Shaila, please.